All right. Good afternoon, everybody. Welcome and thank you for joining us for the 2023 National Virtual CARES Act Conference. My name is Claudia Monterosa, and I'm the Deputy Assistant Secretary for Grant Programs. Just a way of introduction to you all. Thank you again for being here today. Prior to serving at HUD, I served as a chief housing officer for the city of Los Angeles. And so as a former HUD grantee myself, I'm excited for the topics that we're going to be discussing today and the exchange of ideas and best practices among all of you, our grantees. Although the format of this conference is slightly different than the past two conferences, our focus and purpose remain using CARES Act funding to meet the needs of the communities we serve. Together, we have made great strides in administering these funds as we have worked to prepare, prevent, and respond to the coronavirus. Your efforts have not gone unnoticed. We have been able to reach over 15 million people so far through these activities responding to the COVID-19 pandemic. And I actually had the opportunity to meet with some grantees recently on the expenditure of these funds, and very happy to see these dollars go to those impacted communities. We heard from you throughout the nation, and we heard from grantees across the nation that there were very many prolonged challenges based and due to the pandemic that led to expenditure delays. And so as a result of that, HUD listened. And on April 18th, HUD issued a Federal Register notice removing the requirement to expend at least 80% of your CDBG grant funding within 3 years of the grant execution. So I'm hoping that is definitely going to provide you some relief, but that doesn't mean that we take the pedal off the gas, and then we must continue to do everything that we can to deploy these funds as expeditiously as possible. And so while the COVID-19 national emergency ended on May 11th, we know that there's still a lot of work left to do. HUD is here to support you as you continue to carry out meaningful activities to address the long-term impacts of COVID-19 and rebuild stronger communities together. And we hope that the recent removal of the 80% requirement and the information from this conference sessions will help you meet the needs of your communities in two significant ways. First, as the FEMA and Treasury programs either exhaust their funding or time out, CDBG funds, CV funds, may be able to fill those gaps where substance type payments may be made on behalf of the beneficiary. So please do pay attention to that, particular use of CDBG-CV funding. And second, a focus on the prepare and prevent aspects of CDBG-CV program will also highlight how these funds can be utilized to build a more resilient community and prepare the community for any future pandemics or other disasters. And at the bottom or at the core of this conference, that is really what is the impetus of today's sessions. I really hope you enjoy the conference and find the remaining 3 days thought-provoking and inspiring, especially as some of your fellow grantees share their best practices in administering and implementing their CDBG and CDBG-CV programs. We really look forward to your engaged feedback, and thank you again for being with us this afternoon and for the remainder of the conference. And with that, let me turn it back to the facilitators, and thank you so much for your time.
Thank you, Claudia. Welcome to the CDBG-CV conference, where we're going to facilitate 2 sessions today. The first one being to provide you with more information about how to properly administer your CDBG-CV funds. And the second session, which comes right after this session, is going to be to introduce you to several new ways, innovative approaches to spending your CDBG-CV funds to prepare and prevent for future pandemics. With me today is William Roeder, Gary Causey, and Rich Hendershot. I'll have them introduce themselves. We're part of the Corporate Facts team. We're a TA provider for HUD, and we're happy to be presenting this conference to you today. I'll start with Bill Roeder. Introduce yourself, Bill.
Yes, good to be with you today. I'm a former HUD field office person, spent my whole career working in the field. I ended my career as the CPD director in the HUD Kansas City office. I'll be kind of serving as the general facilitator today. And I've been a consultant with Corporate Facts for quite a while now, since about 2007. So it's a great opportunity to join with you today, and I'm looking forward to it. Gary?
Hi, my name is Gary Causey. Just like Bill, I'm a former HUD field person. I was a CPD director in the Jacksonville office up until the end of my career when I retired in 2017. And I've been working with Corporate Facts since then, continuing to do the same kind of things that I love doing at HUD. Glad to be here today. Rich.
Rich Hendershot, like Bill and Gary, I spent my entire career, retired in 2019, spent 40 years in the Columbus, Ohio CPD field office as first a CPD representative, then for the last 25 years as a program manager. Been with Corporate Facts since July of 2020, primarily responding to questions that are submitted from grantees in the Atlanta region, Region 4. So it's a pleasure to be here today with you all.
We'll turn it over to Bill.
Okay, we've got some learning objectives today, going back to my old experiences as a teacher. And we wanted to kind of walk through so you get a feel for the things that we're going to cover in this first part. And we'll touch on them also in the second part of our session. We want to begin with describing the CDBG-CV funding notices that have been published. There are really two that are important, and we'll talk to you about those in some depth. So everybody, we know that some of you are relatively new to CDBG-CV and even relatively new to CDBG. So we want to highlight some of the key provisions that you need to be aware of as you move forward with your COVID funding. We're going to discuss the implementation and approved activities. We've been heartened, as our DAS mentioned earlier, with some of the extraordinary creative things that people have been doing around the country with this funding. And we want to talk about implementing your program and also particularly in the second part, spend some time talking about some really special examples of things that people have been doing. We want to examine progress and the steps to resolve issues related to progress. As with pretty much every federal program, there are timeliness requirements built in. And as the DAS said, while the 3-year requirement has been lifted, we still have a 6-year requirement. And I don't think, as she said, we can take our pedal off the gas at this point. We have to still make sure that we're going to spend these funds in a timely manner. We'll review resources to assess overall performance. We deal with a lot of grantees that have struggled with implementing not only their CDBG-CV programs, but also their regular CDBG programs. We want to give you some guidance on how to deal with the overall performance issues. And then lastly, we want to remind everybody that it's probably time to begin to refocus. If you're like I am, when COVID first hit, I was totally concerned about dealing with the initial crisis that we had on our hands. Hopefully that has passed. We don't have the degree of crisis that we once had. And it's now time to begin to refocus a little bit and think about the second parts of that initial requirement, and that is to prepare and prevent issues like this, particularly COVID, but also some related things in the future. So those are our basic learning objectives for today. Next slide. Okay, here's our agenda. We'll break it down into 5 basic parts. First of all, we want to talk about the background. Where did we come from and where it all started? I realize that our audience is a very diverse one in a lot of ways, including some of you who are relatively new to all of this. So we want to just give you the basics so you'll understand how we got to where we are today. Then we're going to talk about program implementation. You're off and running, but there are other things that you need to consider once your program is in operation. And we'll give you some hints and some pointers on how to do that. Evaluation time. Did everything go as planned? I don't think I've ever seen a program like this where everything went as planned and it didn't require some adjustments or rethinking along the way. And that's built into the program. And we'll talk about that a little bit. Overall performance. Good news, but still work to be done. As I think everybody knows, one of the issues that is out there is the expenditure of funds in a timely manner. And that's one of the things that we're going to talk about, as well as some other issues that might help in that regard. And then lastly, finishing the job. As I mentioned earlier, it's time to refocus on the prepare and prevent part of the initial requirements for CDBG-CV. And before we move on to the next slide, I want to dwell for just a minute on the background. I was thinking about this morning. As you probably have figured out, I'm relatively old, and I was a fledgling HUD urban planner and CPD rep in Oklahoma City when CDBG was born in 1974. And just a little background, we're almost, I guess, now to our 50th anniversary for the program. Just so you'll understand kind of where we came from, prior to the creation of CDBG, we had 8 separate what are called categorical programs at HUD. And it was tough not only for us to administer them, but for cities and states and counties to utilize those funds, because the funds were awarded on a competitive basis, and you might win or you might not. CDBG replaced that with basically certainty of funding. In the process, they pretty much said, we're going to keep all the eligible activities that those 8 separate programs used to have. So CDBG is incredibly broad in terms of its reach. Almost anything you would want to do, there's a way to do with CDBG and CDBG COVID funding. I think another important element, it added funding certainty. So if you're an entitlement city or state, you kind of know that you're going to get funding each year and you have a general idea of how much. And for the first time, that allows you to do long-term planning. Things that might take 2, 3, 4 years, you can do that with your program. And then lastly, and most importantly, when we transitioned from those categorical programs to CDBG in 1974, for the first time, we put local control in local hands. So it wasn't Bill Roeder telling you what to do with your HUD funding. You had the HUD funding, and within the broad parameters of the program, you can decide what your priorities are and how you want to spend those funds. So I think it was a terribly important event that got us to where we are today. And I just wanted to share that with you so you get an idea of what things were prior to the days of CDBG. Next slide. Okay, we wanted to begin today because I mentioned that timeliness is an issue for everybody. And even though the 3-year rule has been set aside, we wanted to get a sense from the audience of where you are in terms of expending your current CDBG-CV funding. So if you will, respond to this poll question. What percentage of your grant has been expended to date? Below 25%, 25 to 50%, 50% to 75%, and more than 75%. We'll give you a moment to think that over. Okay, looking at the results, we've got a pretty good distribution. 17% are below 25%. 24% of our respondents are in that 25 to 50% category. 37% in that 50 to 75% category. And I have to admit, I'm surprised. There's almost a fourth of our respondents are in that 75% category, and that's very good to see. So maybe those latter two groups aren't as concerned about timeliness as others, but there are always going to be issues, and we'll talk about that and some of the flexibility that's built into the program. Thank you for responding. Next slide. Okay, those of you who have been with CDBG-CV from the beginning will recall that this program was launched in what is a rather unusual way. Normally, a program is launched with the publication of a federal register that provides the specific rules related to a given program. But think back to the urgency that was associated with this program back in 2020 when the program began. And HUD did something that, in my experience, was rather extraordinary, and that is they sent out a memo, a policy memo to everybody, announcing the program and trying to give you an opportunity to begin thinking about how your program wants to go. So that you can go back to that original April 9th, 2020 memo from Acting Assistant Secretary John Gibbs. And I just wanted to highlight that briefly because many of these points were ultimately picked up in the Federal Register, which we'll discuss. First of all, it summarized the initial funding, so everybody understood how much money was out there and how it was allocated. It provided for increased HUD authority to grant waivers. Recognizing the unique circumstances, I thought it was great that HUD recognized from the beginning that they were going to be as flexible as the law allowed to grant waivers when it got in the way of doing the things you needed to do to deal with COVID. So that was an extraordinary circumstance in my experience. It eliminated certain unrelated statutory requirements. There were things that you normally do with your regular CDBG program that didn't need to be addressed in your COVID funding. So it simplified things in a lot of ways. The next one you're going to hear us talk about this probably a half a dozen times today. It eliminated that public service cap. For those of you who are familiar with the regular program, in your regular CDBG program, you can spend money for public services, but you can't exceed 15% of your total funding for that purpose. For the very first time, we had a program that said, as long as you're using for the COVID purposes, that 15% cap does not apply. And if you think about the typical things that folks have done with the money, that was a critical decision early on to eliminate that public service cap. The next one, it allowed reimbursement of costs incurred since the first case of COVID was recognized, which is January 21 of 2020. Some of you who are worked with the regular program are familiar, for example, with the pre-award option that's offered in the regular program, but that can be somewhat cumbersome and difficult. So they just acknowledged the fact that a lot of agencies had already expended a significant amount of money on eligible COVID-related activities, and they were allowed to be reimbursed with your CDBG-CV funds once you got those funds in hand. So we would encourage you, particularly those who have struggled maybe with timeliness, to reach out to those other third parties, health departments and other governmental entities and nonprofits who are engaged in eligible CDBG-CV activities. And if you've got the money in your budget, you can always reimburse them for their documented costs that occurred from January 21, 2020 and beyond. It streamlined the citizen participation and public hearing process. As you know, there's a process you go through with your normal CDBG and other formula funding, and it simplified the public hearing process and the timeframes involved, again, in an effort to expedite this program as much as possible. It extended deadlines for submission of your consolidated plan and annual action plans. As you know, once you've decided what you're going to do with the funds, that has to be reflected in your plans. And depending on where you were at any given time, that might have been your consolidated plan, or it might have been a substantial amendment to your annual action plan, but it made that process a little bit easier for everybody. And then lastly, I think, and this is important, my experience has been a lot of people overlook this. It enabled you to use your regular 2019 and 2020 CDBG grants for COVID-related purposes. And in doing so, it allowed you to take advantage of things like the public service cap being lifted. So a number of grantees looked back and said, you know, we've got a higher priority here now. We've got funds in our 2019 or 2020 programs that we would like to reallocate to COVID-related purposes. This made that clear. Let me ask the other panelists, anything I've missed in this April 9, 2020 that you want to mention? Okay, next slide. Okay, now we're going to move on to the actual Federal Register notice, and I'm not going to try to cover it. I think it's 40 or 50 pages long, but I do want to hit some of the highlights that I think everybody needs to be aware of. And that specifically was Federal Register Notice 6218-N-01. And I encourage everybody to have a copy of that as you work with the COVID program. It provided a notice of rules, waivers, and alternative requirements for the program. So it basically pointed out that regular CDBG rules apply to this funding unless specifically changed by the notice itself. And there were a number of very important specific changes, and we'll walk through those with you. Talked about funding allocations, how the money came down, how it was allocated. And then the phrase that people use all the time now with COVID funding is, it made it clear that the principal purpose of this funding was to prevent, prepare for, and respond to CV. And that's the guiding light for all of the CDBG-CV funding. So as I mentioned earlier, it provided changes to your regular consolidated plan or annual action plan submission process. Again, I think it was an effort to help you to expedite so that we were all in that crisis mode and we wanted to get the money out there and start using it as quickly as possible. So there was a process to receive your CDBG-CV funding grants, CV1 and CV2. And then there was that expedited citizen participation process that I mentioned earlier, not only expedited, but simplified, because people recognize that the traditional citizen participation process that you use for your regular formula funding probably doesn't work well in a COVID environment. And then lastly, it talked about allowable costs, eligible activities, and national objectives. Just a reminder that while this differs from CDBG in many ways, it's primarily a CDBG-driven program. So anytime you're thinking about what you want to do, you're going to have to go back to your CDBG materials and be sure that what you're doing is allowable, it's an eligible activity, and that it meets one of the 3 national objectives. Next slide. Again, with that notice, approvals and grant approval agreement process, just a few quick reminders. Don't forget that all of your federal funding, including this funding, is subject to the same normal other federal requirements that you deal with all the time. From your environmental requirements in NEPA, to the Uniform Act, to the OMB 2 CFR 200 financial management type requirements. Those rules were not set aside. You still have to operate in that environment. Talked about the period of performance, timeliness, and closeout, which we talked about earlier. Originally, as we mentioned, there was a 3-year 80% rule built into the program, and that has been set aside. But at some point, we're going to be talking about timeliness again, and eventually closeout. So just keep that in mind. Reporting, including primary benefit tests. And I think this is important for us to mention here. Those of you familiar with regular CDBG know there's something built into the program called the primary benefit test. or the 70% rule. And that rule basically says you can spend your money on any of the 3 national objectives, but your program as a whole must spend at least 70% of your money on the low and moderate income benefit category. What does that mean? That means, once again, that as you think about your CDBG-CV funding, you have to be looking over your shoulder and, to the maximum extent possible, make sure that that money is used primarily to benefit low and moderate income people. So it's nothing new, but that rule was not set aside just because this was COVID funding. And then the last item is something that my experience with CDBG comes up very rarely. It comes up with disaster recovery work sometimes, but it's a major consideration with your CDBG-CV funding, and that's duplication of benefits. You cannot pay twice for the very same thing. Now, that does not mean you can't pay twice for the same kind of activity, or you can't supplement other funding with CDBG-CV funds. But you can't pay somebody's rent if it's already been paid by another source. That's a duplication of benefits issue. And we'll touch on that later, but I want to pause here just to mention, we've talked to a lot of people about this duplication of benefits issue who have never dealt with it before. And we've pretty much come up with what we think is the best approach to be used. And that is, if you're dealing with somebody and you're concerned that they might have already been paid from some other source for the very same thing, i.e. a duplication of benefits, you need to have a certification form of some kind signed by that individual that they certify that they have not been paid for this very same thing previously, or if they are in the future, they will notify you. So duplication of benefits, something we don't often think about with the regular CDBG program, but can be a significant issue with your COVID program, given all the funding sources that have been out there. Okay, next slide. Okay, you're going to hear us talk about this term tieback over and over and over again. And I have to admit that when we started with CDBG-CV, my notion of what constituted a little legitimate tieback to COVID-19 was very limited. But as time went on and we began to realize all the possibilities out there, HUD was very flexible in terms of broadening that range of activities and considering a variety of things that have legitimate tiebacks to COVID that I think are very important to make your program work. And we're going to go into that in some depth in part 2 of our session. It modified the low and moderate income job creation and retention criteria. I'm not going to go into that in depth because we have a whole webinar just on that subject, but those of you who have dealt with economic development with your regular CDBG program know there's some specific things you have to do in order to qualify. Particularly, you normally have to get the income of the individuals being hired or retained in their jobs. This simplified that and established a standard based on the income that is provided with it. And it basically adopts a Section 8 approach. So it simplifies that whole job creation, retention, low mod income benefit criteria considerably. For those of you who have done special economic development with your CDBG program, where you provide financial assistance to for-profit businesses, they simplified that process. And as I say in the next bullet, they basically eliminated the 2-tiered requirement that's built into your regular program. Those of you who have done this know that there's 2 standards. There's a $35,000 per job standard for your program as a whole, and a $50,000 per job standard for any individual project. Well, this just basically said your standard for CDBG is $50,000, which I think makes a lot of sense given the circumstances. It did another important thing. My experience is that not a lot of CDBG grantees use their CDBG funds for what are known as emergency assistance payments, things like helping someone with their rental payments or maybe even their mortgage payments. And as you know, with the regular program, that's limited to no more than 3 months of assistance. CDBG changed that to 6 months of assistance. So you have a much bigger range of assistance that you could provide. And then lastly, the thing we'll probably touch on more than any is removal of that 15% public service cap. I think this is a great opportunity for those of you who have a serious need for additional public services to maybe refocus your regular CDBG program and rethink your CDBG-CV focus with a heavy emphasis on public services, given the nature of what COVID is all about. Okay, next slide. So now we're off and running. We've done all those preliminary things that needed to be done, and you've now done your consolidated plan or your annual action plan. You've done your substantial amendments, and you know what you're going to do, and you're off and running. Just a few reminders that we think are important. As I mentioned earlier, the standard OMB 2 CFR 200 rules apply. That includes federal procurement requirements and the 5 options that are available to you when you're spending your federal funds for acquiring goods and services. And just a reminder that if you're going to be selecting a professional services contract, for example, I would go back and make sure you're doing so in compliance with those procurement requirements. And in this particular case, that would probably mean an RFP or an RFQ of some kind. But you want to demonstrate that you are in compliance with those procurement rules in 2 CFR 200. You're probably going to be dealing with a variety of third parties in your program, and HUD basically has, 3 categories of third parties. There's subrecipients, typically nonprofit groups that will carry out some aspect of your program on your behalf. That also includes other governmental entities that you might have an intergovernmental understanding with to carry out aspects of your program. There are also occasionally developers that are involved. Developers can be designated, but they normally are selected on a competitive basis. And you have to be sure to do an underwriting analysis to be sure developers are not unduly benefiting from the program. And then contractors, your traditional contractors. You're probably going to go through that standard competitive sealed bids if it's a construction contract that's called for an OMB. So this is just a reminder. Don't forget that those rules still apply, even though this is COVID funding. At some point, you're going to award those funds to those third parties. Might be a subrecipient agreement, it might be a developer agreement, or it might be a construction contract that you have to go through that process like you always do. And then you execute the contract and agreements. And this is important. I've seen a lot of subrecipient agreements and third-party contracts that didn't do a good enough job of establishing performance measures so that you can hold them accountable to meeting certain benchmarks, both qualitative and quantitative. So anytime you're issuing a subrecipient agreement or some other form of contract, you need to pause and ask yourself, have we built in the necessary performance measures that will enable us to adequately monitor and manage that program in the future? Okay, next slide. So did everything go as planned? No, it almost never does. But you've got to stop at this point and ask yourself what has worked and what hasn't worked. And then you're free to make whatever adjustments you might need to based on that experience. Have you had significant delays in carrying out certain activities? Have you had major obstacles of some kind that have gotten in the way? And what can you do to deal with those obstacles? Or maybe challenges. Maybe you don't have an adequate base of subrecipients that you can utilize to carry out certain aspects of your programs. Those are all issues that come into play at some point along the way. So dealing effectively with program problems. I have dealt in my consulting career, and even when I was at HUD, with a number of folks who had what are generally referred to as timeliness problems. They're not expending their funds in a timely manner, and eventually that will catch up with you. I can say I've not had one that I've worked with yet that had what I would call an adequate program activity tracking system to identify and correct problems. And what do I mean by a program activity tracking system? If I were administering this program locally, I would Well, I wouldn't because I don't know how to use a spreadsheet very well, but I'd find somebody that does. And I would sit down and I would prepare a spreadsheet. And the spreadsheet would look something like this: CDBG COVID funding. And I would list every approved activity that I've got. And then I would project expenditures for each of those activities on a monthly basis throughout the course of the program, based on the best information you have at the time. And then I would overlay on that the actual expenditures. So you can identify early on when something is falling behind. And that tells you as a manager, I need to reach out to that developer or nonprofit and find out what's going on and make sure that we're going to catch up, or we're going to do the things we need to do. Or maybe it's time at some point to change direction and deobligate and reallocate funds. That is critically important if you're going to ultimately manage this program in a way that assures timely performance. And based on the last information we had, the national reports show that there still are substantial amounts of unexpended funds around the nation. So we know this is an issue based on that initial survey question we asked. For some of you, it's a significant issue. So just be aware that this program has to be actively managed, and you have to deal with problems as they occur, particularly timeliness problems. So be sure those requirements are met. Okay, next slide. So now for the good news, but more work to be done. The good news, as you heard earlier, we were struggling with a lot of grantees to meet that initial 3-year 80% rule. And fortunately, that rule was set aside. Now, if you're like I am, and you were struggling to meet a deadline, and suddenly somebody comes along and removes that deadline, my tendency is to take a deep breath, and suddenly this is no longer the priority it once was. And as our Deputy Assistant Secretary said, we have to continue to focus on this. Even though it's now simply a 6-year, 100% expenditure rule, we've got to make sure that that happens. And without getting out in front of anybody, if you've been following the latest debates in Congress about various funding issues, one of the issues I keep seeing come up is what might happen to any unexpended COVID funds, not just the CDBG-CV, but other funds. So just be aware that that's an issue, and I would not let this program slide simply because the 3-year rule has been set aside. So the next thing is what lessons have been learned along the way. And we're going to spend a considerable amount of time in part 2 talking about some of the things we've learned. And when I was at HUD, the thing I learned the most was from grantees who were doing some extraordinarily creative things. We used to have an annual best practices conference in our office, and I can tell you we never lacked for a number of great best practices, things that people were doing that they wanted to share with others. So lessons learned from what you've been doing so far. Pause and ask yourself, what have we learned and what maybe corrections or changes we need to make? And examples of outstanding and creative activities. We're going to dwell on that in part 2 of this session later on. Okay, next slide. Poll question number 2. Do you believe you will have trouble meeting the 6-year expenditure deadline? Not the 3-year, but the 6-year expenditure deadline. Based on what you know now, let us know, yes or no. Okay, looks like the overwhelming majority of you believe you will not have a problem in meeting that 6-year expenditure deadline. For those of you who do believe you might have a problem, this is the time to take another look at your program. There are a variety of issues that come into play when you do have a timeliness problem. Probably the single most common example I've had is people bought into program activities that are very long in development, that take longer than you probably have. If that's the case, you need to rethink that and see whether or not you want to reorder your priorities. Other things, basically goes back to what I mentioned earlier about having an active management and oversight process so you can track individual activities and make sure each activity is on time. And then don't hesitate to hold third parties accountable when they fall short. That's part of the process. But I'm encouraged to see 84% of our people believe you'll meet that 6-year deadline without too much trouble. So that's good to see. Next slide. So now finishing the job. As we mentioned earlier, most people were initially concerned almost exclusively with how to deal with the initial crisis at hand. Hopefully that has passed, and we're now at a point where we have to rethink and ask ourselves, what additional things can we do to prepare and prevent for the next emergency that might come along? Obviously, you have to have a COVID tie, but a lot of the things you're doing to deal with COVID will also help you with other potential emergencies that might occur down the road. So we wanted to talk about that a little bit. So the first thing I wanted to mention is that while you are going to think about activities that can help you with a variety of emergencies, if you're using CDBG-CV funding, it always has to have that CV tieback that we're going to talk about more in part 2. So you can also provide assistance for other emergencies as long as you have that CV tieback. The thing that comes to my mind is most communities have some sort of an emergency shelter or emergency facility that people can go to if there's tornadoes or storms or floods or whatever. Things you do for COVID can also benefit you in terms of preparing for other kinds of emergencies. And that's perfectly okay as long as you have that COVID tieback. If you're using your CDB funding, you could always take advantage of those expedited citizen participation rules that we talked about earlier. If you want to simplify that and shorten that time frame. And another reminder, don't forget that if you had planned to use some of your 2019 or 2020 regular CDBG funds for COVID, you could continue to do so. You could even amend those if need be. So a lot of people that I know of have done that, given the circumstances they're dealing with. And again, you've heard me mention this over and over again. I cannot think of a better time for you to maximize that public service cap. A lot of the grantees I've worked with have had a great need for public services, and COVID just made that even more significant. So give some thought to the public service cap, things that you could do now that you wouldn't be able to do with your regular program because of the 15% ceiling. Okay, next slide. So let's go back and refocus on the prepare and prevent part of this equation. As I mentioned earlier, do not forget about the option of reimbursing costs incurred from January 21st of 2020 with other public agencies. If you haven't reached out to them and you have a considerable amount of money available to you in your COVID funding, this is the time to do that. Ask them to provide you the necessary documentation to show those expenditures were COVID related, they were CDBG eligible, and then you'll always have the option of reimbursing them if you want to. Don't forget, you still have to focus primarily on that low and moderate income benefit requirement. So while you can do a variety of things, your program primarily has to be focused on ways to help low and moderate income people. I would revisit my initial partners in the process. Probably more often than not, those would be subrecipients, nonprofits, homeless shelters, and the like. And see whether there's something at this point they want to redo or expand in order to broaden the program and help you not only deal with COVID, but other related emergencies. Remember the economic development provisions that I talked about earlier? If you've got a regular CDBG program, economic development program, you probably want to go back and take advantage of those simplified rules that apply to COVID funding. Again, it only applies to COVID funding, but now is your opportunity to do that. Use emergency assistance flexibility. This is a special situation. And if you've got an activity or issue that is preventing you to do something that you believe needs to be done, that's the time to contact your local field office, explain to them what you're considering, and take advantage of that flexibility that was built into the program from the very beginning. And then lastly, again, a reminder that you have to be aware of duplication of benefits. The example that comes to my mind is I've got two neighbors who own small businesses that basically shut down during the COVID period. They received funding from other sources to cover themselves during that period. But they also probably need some additional assistance at some point. It's not, as long as you're not paying for the same thing twice, you're okay. But just be aware duplication of benefits is an issue that has to be considered in this regard. Okay, next slide. Okay, now is the opportunity for us to cover any questions that we've got, and I would invite all the other folks to join in as you want to. Can we see what we've got, for example, in the Q&A or chat room?
Bill, I'll read the questions. Some of these we've answered in the chat, and we'll read those as well. But there are a few of these that we thought would be better just to discuss.
Okay.
First one, I think you've already touched on. Will there be a recapture and reallocation of CDBG-CV funds?
If you're talking about a recapture and reallocation by HUD, no such thing is envisioned at this point. I have not seen anything indicating that. If you're used to the regular CDBG program, you know there's a 1.5 timeliness test built in. And if you fail that test more than once, you're subject to having funds deobligated and recaptured. But I have not seen anything, unless somebody else has, that indicates HUD has taken steps specifically for the COVID funding to recapture and reallocate. Am I correct? Anybody seen anything on that?
No, but what about at the end of the 6 years? If you've not spent your money at the end of the 6 years?
HUD has not issued anything yet about what would happen at the end of the 6 years. My experience with other HUD programs that had a specific lifespan is that when that lifespan is over, HUD does recapture those funds. Oftentimes Congress builds that into the legislation, but no, I have not seen anything specific as to the 6-year rule and what will happen when we reach that point.
And I think a related question someone asked was, does expend mean under contract?
No, under contract does not mean expend. The simplest way, Michelle, that I can think of to explain expend is, if you've put it into IDIS and it shows up as expended, that's what counts. But under contract does not. Now, under contract has some other benefits, obviously, but no, that does not count as an expenditure in terms of meeting either the original 3-year test or the 6-year test. The money has to be actually expended and recorded in IDIS.
Thank you. So what measures should you have in place so that you are ensuring you don't have cases of duplication of benefits? In emergency management, insurance is the first bite regarding reimbursable funds.
Absolutely. I think I've had more experience in dealing with this with a disaster recovery situation where there are multiple funding sources like insurance and other programs, and then oftentimes the HUD funding is the last money in. What I would do is what I mentioned earlier. I would develop a simple certification form. Depending on the kind of assistance you're concerned about, you might even list some examples on that form of possible other funding sources that someone might have received. For example, a small business that you're trying to assist. And then again, I would have, and you'd have to have lawyers review this and approve it, but I would have a certification form that at the bottom requires that person or business that's being assisted to indicate that they have not received any other funding for that specific thing, not that kind of activity, but that specific thing. Or if they receive funding for that in the future, they will notify you so that some sort of rebalancing can occur. That's the best and simplest way that I know of, because let's be honest, you're not going to know necessarily whether they got additional funding from their bank, as my neighbors did with their small businesses. So you're going to have to develop something that puts them on the line. And if at some point in the future you discover, yes, this is a duplication of benefits, now you've got a certification that you could use to go back and recapture those funds.
And here's a related question, Bill. Is there a standard HUD duplication of benefits certification form?
Good question. Go ahead, Michelle.
I just said I was looking for one. I couldn't find one while the question was up, but we'll follow up and drop that in the WOBA discussion board after the session.
Michelle, I recall when we were working with the Superstorm Sandy, that there was a form. I don't know whether it was a HUD approved form, but I do remember they had a certification form that listed the typical kinds of other funding like insurance, like FEMA, and so on. So even if there isn't one for COVID, it wouldn't be difficult to go on the HUD exchange, pull something down and modify it for this purpose.
Okay. If a subrecipient expended funds and didn't implement a duplication of benefit policy, are all of their expenditures ineligible?
No. Those expenditures are not ineligible, but I would do as a protection to you, even if it's after the fact, I would go back to those entities or individuals, and I would again ask them to sign a certification of some sort. So you now have a legal recourse if that ultimately comes back to be an issue. But no, those funds are not automatically disallowed.
One more on this topic and then I'll move on. So if a small business received PPP money, can they duplicate what they use PPP money for?
That is the gray area. We get this question all the time. And let me see if I can explain. Duplication of benefits does not mean that you use 2 or 3 different sources of money to fund the same activity. Duplication of benefits means you use multiple sources of money to pay for the very same thing 2 or 3 times. The latter is a duplication of benefits and it's prohibited. The former is certainly permissible because CDBG was born with the idea that it can be used as a funding source to supplement other funding sources for given activities. It just can't be spent. You can't double dip, so to speak.
Okay, how about this one? When we look at the possibility of reimbursing other public agencies for incurred costs back in 2020 and 2021, we see issues with supporting documentation. They weren't collecting data on beneficiaries in the way CDBG would ask for. Our county council gave pandemic relief grants to nonprofits that they then went to pay for anything from means for shut-in seniors, rent utility support, utility providers paid on behalf of individuals, PPE, etc. They assume we could reimburse with CV funds, but we are challenged by lack of documentation on beneficiaries.
This is an issue we've dealt with a lot, isn't it, Michelle?
Yes, it is.
The normal rules apply to CDBG-CV as any other federal funding, and that is you've got to be able to provide documentation to support those costs. Now, what that means is going back to these entities and saying, can you provide copies of invoices or timesheets or other legitimate, specific documentation to support the cost? If you can, then you can use CDBG-CV to reimburse for those costs, provided they're regular CDBG-CV eligible activities. If you don't have that documentation, I'm sorry, but I wouldn't suggest you go down that path. So you got to go back to them and say, please provide us the specifics to support those costs. And once you've got that, then I think you're in a position to reimburse.
All right. Can grantees use CV funds to develop a future pandemic response plan to address mental health, public health, broadband, and economic recovery for their whole community?
That is a great question, and it's one we're going to talk about in part 2 of this session as a tantalizing leader into this. But yes, I don't look at CV as a unique and narrow and distinct thing. I think an awful lot of the things that folks are doing to deal with CV are going to be beneficial for any future disaster, including the next pandemic. The answer to your question is, I think it's important to look broadly. You still have to meet the CDBG-CV tieback requirements, but is that going to help you prepare for the next whatever? Yes, it will. And I think that's very, very important. Michelle, I think we're running out of time. I saw a note. Do we want to remind? Go ahead.
I was going to say it would fall up under the planning eligible activity and subject to the 20% cap.
Good. I think somebody said a note. If you've got additional follow-up that you would like us to address, you can go to that WOVA site that you were all given earlier. And that's a great place to do it. We'll be looking in there later on. And if you've got additional questions, we'll try to address them there.
We'll also continue this discussion in part 2. And if we have time, we'll continue to answer some. We've got quite a few questions, and we'll try to answer a few of those in part 2.
Very good. By my clock, we are right on the money. Am I right? Or do we have, we have additional time, don't we? We have 15 minutes. Okay.
I think we have 15 minutes.
Yeah, you're right.
So I'm going to keep asking questions because there's quite a few.
Good.
Could you please restate which is the maximum assistance to businesses?
Yeah. Under your regular CDBG program, if you provide financial assistance to a for-profit business, that's what's generally referred to as special economic development. And if you read your CDBG rules, there's a section devoted to that that's called the public benefit test. And it was done to prevent grantees from spending way too much money per job for special economic development. It gets complicated, but the bottom line is that for a typical entitlement grantee, that rule says you cannot spend more than $35,000 per job for your economic development portfolio as a whole. And you can't spend more than $50,000 per job for any individual project within that portfolio. So CDBG COVID changed that and basically eliminated that $35,000 per job for your portfolio as a whole. And the test now is just $50,000 per job. So if you're spending CDBG-CV for special economic development assistance to businesses, you cannot spend more than $50,000 per job that's created or retained. That's the bottom line. There's just one test now for CDBG-CV.
Great, thank you, Bill. I thought the citizen participation rules have sunsetted.
They don't apply to anything other than substantial amendments to your original CDBG-CV, either consolidated plan, annual action plan, or substantial amendments there too. So no, those rules, I'm not aware. I have not seen anything. Let me ask any of our other panelists. Have you seen anything indicating that those original simplified CP rules have somehow been set aside, I think they can still utilize them, can't they?
They can, because remember, you're amending, if you're going to make an amendment to your plan, you're amending your 20 or 2019 action plan, even though you're either in your regular 2022 or 2023 CDBG year. These amendments would apply to the previous plan. So there is a couple lines in the federal notice that speak to that, but you can still use the shortened CP period.
Great. Okay, since the national emergency declaration has expired, are we still able to use the emergency waivers?
HUD is still open to waiving any requirements that are not in violation of the statutes themselves. So that original provision that I talked about at the beginning, where HUD's actually was directed by Congress to be as flexible as possible in terms of considering waivers, is still out there. It's never expired that I'm aware of. So if you've got something now and you're not sure, contact your field office. And if they feel like it might not be in keeping with current regulations, they can always go to Washington, make the case on your behalf, or you can go with them, and basically say, we would ask for a waiver. And my experience has been HUD has tried to be really, really flexible in that regard. So that original, call it expanded or enhanced waiver authority that came with COVID funding is still out there. And I wouldn't hesitate to use it if I had something that was getting in the way of my program now.
All right. Do you have to run another RFP to expend funds, or can you add the CV funds to existing CDBG projects?
Michelle, you can probably answer that better than I, but if your original competitively acquired contract allows for additional funding along the way, you can always do that. It depends on how that original letting of the contract was done. Does that sound right?
Yes, it does. Every time somebody asks a question, it jumps around. Let me get back to where we were.
Okay.
A lot of duplication of benefit questions.
That's a tough one.
Yeah.
We get those questions, as you know, all the time, Michelle, and am I actually paying twice for the very same thing, or am I just providing additional money for the same kind of activity? And that's the distinction that has to be drawn. And I've had a lot of people that shy away from using CDBG-CV to supplement other funding that's out there for fear they're violating the duplication of benefits rule, when in fact they're not.
Great. Okay, if an agency is providing CV funding for emergency homeless shelter, the recipients must have a documented COVID tieback, right? Like a COVID-19 job loss or comorbidity associated with the COVID-19.
Yes, but I think if you're dealing with a homeless situation, particularly a homeless shelter, the tieback is almost automatic. We'll talk about that in some depth later on, but I go back to when we first started dealing with COVID and CDBG-CV came along. Think about the typical homeless shelter that did not have adequate social distancing, screens and other partitions that were necessary. Their food facilities weren't designed to prevent the spread of COVID. Their restroom facilities were not adequate. Maybe their HVAC system was not adequate to prevent the spread of COVID. Those things are all permissible and are still permissible, and I think are a very, very high priority.
Okay, we may need to go back and re-clarify this, Bill, but a couple of people have said that they heard that the $50,000 per job was waived and it's $85,000 for CARES Act funding.
I have not seen that, Michelle. The only thing I saw in writing was that that was in the Federal Register notice itself, and that was still at $50,000. Now, I've had conversations with people over the last few years saying that original $35,000, $50,000 rule has never been updated for inflation. And I know there's been at least some consideration at HUD to do so, but I've not seen anything official that says that that $50,000 rule has been raised. Anybody else? Have you seen anything indicating it's gone higher?
I haven't seen anything either, Bill. That issue is addressed pretty well in the FAQ from August 27th of 2020. There's a couple of questions related to that economic development in that. And back to the duplication of benefit, there is a duplication of benefit FAQ. And there are also a couple of questions in the same August 27th of 2020 pretty comprehensive FAQ that deal with, provide a couple of duplication of benefit examples.
You know, there's one other thing, Rich, that I forgot to mention that I think I need to mention. A great resource for you, we'll talk about other resources later on, but if you haven't already, go to HUD.gov, call up the HUD Exchange, go on the HUD Exchange and register. And when you do, take the time to indicate the specific program or programs that you're interested in. And if you're like me, what that means is every time there's a new significant issue related to that issuance related to that program, I automatically get a notice. And that helps me to keep up with what's happening out there with these programs. So because you're dealing with CDBG-CV, I'd go to the HUD Exchange, I'd register, and then I'd indicate, because it gives you a pop-up menu where you can indicate the specific things you're interested in. I would say I'm interested in CDBG-CV, and then as additional things come along, you'll be kept aware.
Okay. Again, a lot of duplication of benefit questions.
And that's one, Rich, I think it's important. A lot of that is addressed in the FAQs that you can get through the HUD Exchange, right?
That's correct. Yep. The two I mentioned earlier specifically, yes.
What data should CV grantees use to document the tieback for how they are preparing for a future coronavirus when funding 23 to 26 activities in communities where there is no sign of coronavirus right now?
That's a good question. Just because the coronavirus isn't shown in any hard data doesn't mean it still isn't out there. I'm not a doctor, but my doctor tells me that it's still out there. There are still people getting sick, and there are even people still dying. So I wouldn't let that be a hindrance to utilizing your CDBG-CV funds for that purpose. And again, keep in mind that the original directive for CDBG-CV was not just deal with those cases you've got, but prepare and prevent. So I think you're broadly permissible, even if you have no evidence of active cases in a given geographic area.
And here's a related question. How can you justify rental assistance now that the pandemic is over?
Keep in mind that even though the pandemic is over, a lot of people were hurt badly because they lost their jobs or they lost their businesses, and they need some relief. But yes, I think you need to rethink that at this point and ask yourself, do you still want to engage in rental assistance or mortgage assistance at this point? And that's a situation that's permitted, but I would look at it on a case-by-case basis. Maybe at this point you think maybe that's not the priority it once was, and we will redirect some of those funds to other activities. But again, it's permissible. It's never been taken away. And I think you can still do it if you feel like that's what you want to do.
Lots and lots of quick questions still about the $85,000 per job. There's lots of mention about it being part of a waiver. And again, I think we'll answer that formally in the WOVA discussion board.
Good. We'll research it and see if there's an instance where HUD has granted a waiver, given the special circumstances. $85,000 per job kind of makes sense, given that the $50,000 per job was established, what, literally decades ago. But again, I haven't seen anything officially doing that. So I can't say one way or the other.
Okay, there's like I said, lots of duplication of benefit questions.
Michelle, I'm seeing 3 wrap-up slides, including a brief discussion of the WOVA options. So maybe we ought to move on to our next slide and wrap it up at this point and take up some things in part 2.
Yes, we've only got a couple of minutes left. So again,
okay,
we'll follow up on the WOVA discussion board.